Welcome, everyone, to this episode of the Sunflower Palliative Care Podcast. This is the podcast where we explore all aspects of children's palliative care. We have a big, amazing, inspiring community, and this podcast is here so we can share, learn, grow, and hear from each other's stories so we can inspire each other to continue to do this hard but fulfilling work. I'm Natasha Datoo, a volunteer with Two Worlds Cancer Collaboration. I'm a pediatric oncologist at BC Children's Hospital in Vancouver, Canada, and a palliative care specialist at Connect Place Children's Hospice. We are here for our second of 4 podcasts in a series of podcasts where we're talking to some of our pediatric palliative care leadership program graduates and participants about some of the really inspiring initiatives they're starting in their home communities. The Sunflower Children's Network, alongside various other participants in 2023, started a leadership program that brought together young and inspiring healthcare professionals who are engaged and wanting to provide pediatric palliative care in South and Southeast Asia. So today, for our second podcast, we are talking with Roshani Tuitui, who is a chief nurse manager. She's been a nurse for 25 years and has worked in various different hospitals, including pediatrics, all throughout Nepal. And now her role is to teach, engage, and support nurses from her hospital. And today we are talking to Roshani about her project. So I wanted to say welcome, Roshani. Thank you for joining us today.
Yes, thank you, Natasha.
So maybe I'll let you introduce yourself because I'm sure you'll do a better job. So can you tell us a little bit about yourself and what you do?
Namaskar and good morning or good afternoon to everyone. This is Roshani Tuitui from Nepal. I am a chief nurse as well as a nursing director of one of the children hospital in Nepal under Ministry of Health and Population. This is the only one children hospital under Nepal government. And I am looking after clinical nursing management as well as the academic programs for the bachelor and master's nursing. In our hospital, we already have the different care services, including preventive, promotive, curative, and rehabilitative. And we also started the palliative care in terms of the inpatient services. But very few health workers, especially doctors and nurses, are sensitized and trained about the palliative care services in our country.
Thank you, Roshani. And I had the pleasure of meeting Roshani a few years ago, and I learned so much from you already, meeting you and hearing your experiences as a nurse for all these years. um,
Yeah. We did the one, I think, master classes on the pediatric palliative care in the Kanti Children Hospital.
yes, we did that together, I think in
Yeah,
2.5 years ago.
yeah,
Well,
I
it's
think.
nice to talk to you again. Can you tell me why did you want to participate in the Children's Palliative Care Leadership Program last year?
Yeah, one major thing is that the children do not verbalize their pain and their suffering. We as a nurses must speak or must advocate on behalf of the children. That means we should raise the voice for our voiceless children. And most of the time, for the curative and preventive aspects, their parents are most eager. But in terms of the palliative, it's a neglected cure. So, what I want to do is just raise the neglected care and care for the speechless or voiceless children. That's why I just, with these all things, I just want to participate in this program. That's a leadership program for children's palliative care. And through that program, not only myself, I can just expand these services with not only within the children hospital but in other hospital where children services or childcare services is available. That's why just I'm interested to for this program and join it.
Thank you for sharing. And I think as a nurse, you are at the bedside and you see the suffering of children more so, I think, than the doctors and the clinical staff. As a nurse, you see the parents and the child suffering, and so I think the work you're doing and your advocacy is so inspiring. So, if you remember early on in the program, there was an in-person workshop in Hyderabad where the leadership scholars and the faculty all gathered in India. Were you participating in that? And what was the most memorable part of the program for you? What did you like best about it?
Yeah, thank you. Actually, After participating in the Hyderabad workshop, my concept towards the palliative care is totally changed. Actually, what I learned from the pre-service and in-service education, that palliative care is the end of life care. What I perceived before that, but after participating in the Hyderabad and after interaction with our experienced mentor and the other participant from the different part of the world, what my concept is that yes, palliative care is not only at the end of the life. It should start from the beginning, because palliative means is a relief from suffering, not only the pain. What I perceive before is a pain management and it's a end of life care, but not. It's a beyond that. So, what particular memorable part of this is that now my concept is changed. And the next one is while when we visited the palliative care center in the Hyderabad, where there is a children's palliative care as well as adult over there, the children's palliative care, my focus is only on the oncology condition, but no, yeah, pediatric palliative care is beyond the oncology what to say problem too. So, my paradigm is shifted in two areas. One is palliative care should start from the anytime. It's not only the end of life care. And the next one is what I perceive is it care is only for the oncologic problem, but it is beyond the oncology. That means for the non-oncologic too. So that's two areas is particularly I learned from in-person's workshop. And beyond that, there is also the different scenario. To provide the palliative care is during pregnancy, perinatal palliative care, and then the involvement of the community, and then home base. These all things I learned, and among them, the most memorable part is the paradigm shift as well as the visit to the what's a children palliative care in hospice care, Kundalini hospice care.
Thank you, Roshani. And I think that's such a piece to touch on, that palliative care for children is about holistic care, and it starts from the beginning of a diagnosis of a serious illness. And our hope is to support the whole family and the child, the siblings, the grandparents, as they live through this whole journey, not just at the end. I love that that's what you remember. And I love that you remember that it's not just for cancer patients, but for any child who has a serious illness. And that is such an important, I think, myth that we have to dispel among our colleagues, even. Roshani, can you tell me a little bit about what was one of the things or some of the things that surprised you the most as you started to learn about palliative care?
Yeah, the surprising thing is that now I see the most of the patient, not only the patient, even the other people just see from the palliative eyes, from the children, from my other thing. And I just advocate most of the time for the non-intervention as much as possible because to relieve their symptoms. One thing. Next one, what I surprisingly learned from the workshop is that the fundraising activities, because how to advocate in the short time that the elevator pitch, and then how to advocate with the funding agencies with 1 or 2 minutes and with the catchy words and in the influencing voices. So that's things I actually learned from the workshops, and that is especially seriously just teased by the Justin and then the Spandanamam, Dr. Gayatri, Megan. So these people are my source of inspiration for the palliative care. With very short voice and a low voice is how we can advocate for our future, for our children, not only in the fundraising, even for expanding the services and other things. So these are the surprising things for me as I learned from the workshop.
Thank you. And what I'm hearing is you have to advocate at a local level, but also at a government level, at a fundraising level, to bring awareness to pediatric palliative care, which is so amazing that you're able to do this.
Yeah, yeah, Natasha. One thing, sir, I want to share is that in Nepal we have at that time we have drafted the national palliative care strategy, and I got an opportunity to review the strategy. But in that strategy, there is no inclusion of the children's palliative care. Once I introduced in that program, and I just got the review, I got the chance to review, and I included that the children's palliative care in our national palliative care strategy. So now our national palliative care strategy, which is already approved by Nepal government, that included the palliative care not only for the adult, even for the children too. So this is the one of the my biggest inputs from this program that I included in our national strategy for the children's palliative care. Actually, previously it was only for the adult.
Wow, what an amazing accomplishment that you were able to include pediatric palliative care in the national strategy. You are very inspiring, Roshani.
Thank you. Actually, I
We're
learned
going
from you all people because you know I already mentioned that my parent thinking and my perception is totally changed in terms of the palliative care. And also, Natasha, in Kanti Children Hospital, in the burn ward, there is no use of the morphine and other thing before dressing. Once we started the session, half day session, now all child get the morphine before dressing. That means they are having the painless dressing for the burn patient. That's another achievement.
Oh, that's so nice to hear that it's continued. What Roshani is speaking to is when we did a workshop at Kanti Children's
Yeah.
Hospital, one of the larger children's hospitals in Kathmandu in Nepal, we recognized there was a burn unit that were doing dressing changes without any type of pain medication for children. And we were able to implement that day in a beautiful way with the support of the burn team and the anesthesia doctors and the surgeons who are all very invested in supporting pain management in children. And so now the children get pain medication and they have less suffering during their burn changes. I'm so glad to hear that that's continued. You know, Rashani, I just want to tell you, I think all of the work you're doing and all the advocacy is going to change the lives of so many children. So I just wanted to say thank you for that.
So thank you. Thanks for supporting us, stimulating us. Not only supporting us, even the stimulus is the most important.
I want to talk a little bit about your project. So each leadership scholar has to develop and conduct a project. Can you tell us a little bit about your project, Rashani?
Yeah, just I want to clarify that before going to the physical workshop, because I was in that children hospital, my previous plan is to start the outpatient children's palliative care in the Kanti Children Hospital. But when I just went to the Hyderabad for workshop, and my priority is shifted because the initiation of the pediatric palliative care in the one hospital is very limited. If I train more human resources, especially doctor and nurses, then their service can be expanded in other hospitals too. So while in the workshop in Hyderabad, my project is changed. Now I am working in the development and implementation of pediatric palliative care training manual for doctors and nurses in Nepal. Why I choose this topic is that main theme is if I implement in one hospital, the service receiver or consumer is very limited. If I train the more people than in the health worker, the service will expand exponentially. That's why I changed the topic as development and implementation of the pediatric palliative care training for doctor and nurses in Nepal.
Wow, so you decided to think bigger and make your project bigger. More work for
Yeah,
you. But that's amazing that, you know, you thought instead of focusing on one hospital, how can I disseminate this pediatric
yeah.
palliative care training to a wider group? That's very inspiring. Can you tell us a little bit about the training? Is it online training? Is it a manual and how you hope to disseminate that to different people?
Yeah. So just I want to share my what to say achievement till now. I decided to work on this project, I did a stakeholder meeting with the Nepal government, Ministry of Health and Population, National Health Training Center, and the related hospital where the children's service is available, including the pediatrician and the pediatric oncologist, as well as the critical care nurses and the pediatric critical care specialist. They all agreed that yes, really palliative care is needed for all children. And they also agreed that let's develop the training manual for the doctors and nurses. Because in our pre-service education, the palliative care topic is very limited. I already mentioned that myself is also very limited as palliative care means end of life care. but nurse is beyond this. So I explained all this importance to the related stakeholder, and they all agreed that yes, really, our country need a separate training manual for the children. Actually, we have a training manual for the other palliative care. We have started that training around 4 or 5 years before, and it was interrupted during the COVID. But there is lack of this such training for the children's. And once I just get the consensus from the related stakeholder, then I started to have a wider stakeholder meeting along with Dr. Krishna Sagar Sharma, and it was supported by the World Health Organizations too. So we did the stakeholder meeting with all related stakeholders that also included the high level personnel from the Ministry of Health and Population as well as National Health Training Center, because now Nepal is in the federalism, and we have a federal government as well as provincial government, and that if it is accepted by the National Health Training Center, it will be quite easy to implement in the hospitals of the federal as well as the provincial hospitals too. So we get the consensus as well as keep the on board for the Nepal government as well as the National Training Center. On that stakeholder meeting, we all agreed to have a 17 modules for the training manual, and we agreed with the development of the three manual that is according to our training center's guideline. That's a trainer manual, participant manual, and reference manual. As I myself as well as Dr. Krishna cannot do all these things, so we formed the one technical working groups that contain the 13 participants that included the oncologists, pediatric palliative nurse, pediatric palliative physicians, and other personnel that included 13 persons. That person we just identified that them as a core team for the right. That core team we met physically as well as the virtually, and we started writing by reviewing the national as well as international training manual on the palliative, though it is adult or children's, and we rewrite it in terms of the Nepal's context. And we around 7 or 8 times we met, and then we prepared the one draft training manual. Based on this draft and training manual, on the 13th and 14th June, we conducted the physical workshop, that means residential workshop. So those people, 13 people, drafted the 17 training manuals, and we worked hardly from day to night for the 2 days. We go line by line and get the constant feedbacks, inputs, and suggestions from the all related stakeholder, and we prepare the one a kind of the manual, a kind of the write up, which we get the consensus from government as well as the other stakeholder. Now I am working on the line by line for each one, whether it is in certain area there is a duplication and certain area there is a omission. So based on the writing as well as feedback from the workshop, now I am going line by line through that training manual and refining, and also preparing the manual for the master classes as well as the training for the others.
Wow, it sounds like a lot of work, but very impactful. Can you tell me a little bit about how do you feel like your project fits with your vision of children's palliative care for your country?
Actually, our country in the strategy, it is clearly mentioned that every individual will have free from the suffering. And same things in my project also, I put the vision as the children with serious illness have access to children's palliative care by trained doctor and nurses with expertise in pain and symptom management for holistic care. So if I completed this project and implement it first as a training of trainer, that means as a master trainer, and they will train other doctor and nurses, which will expand the services exponentially. Then most of the children with serious illness will get the palliative care. So that's training as well as train to other health worker will achieve the vision of our strategy that people with serious illnesses or suffering will get the palliative services from the trained doctor or nurse.
It sounds like the vision and your project fit perfectly well together. It sounds like your goal is to have children be free of suffering, and you are casting a wide net for your whole country to try and achieve this. So, can you tell us a little bit, maybe, what have been some of the successes you've had with your project so far?
In my perspective, the most important things is agreement with the all stakeholders, because it's quite difficult to get the consensus because we have diverse people and diversity management is the difficult. But what I think success for myself is that we get the consensus from the all stakeholders, from government level to the implementation, that is from hospital level. Next one, we agreed to have a writing team with 13 people that included the different peoples from oncologists, from palliative physicians, palliative nurse to other areas. So that is another success what I feel. And the third one is within short period of time, we prepared the very zero draft. That is also the most important because within the short period of time, it's quite difficult to write up in these areas. And another one is we successfully conducted the 2 days residential workshop that gives the inside view as well as very minute suggestions and feedback and inputs to improve that our zero draft. So till now, what I feel myself as a success of this project is these 3 points.
Thank you. And yes, I imagine that getting all the stakeholders from high federal levels, provincial levels, to the hospital, to the clinicians is a lot of work and a lot of negotiating. So I commend you for for doing all of that. Roshani, as you've gone through this journey and this project and all the work you've done, can you tell us maybe a few things that have surprised you?
Yeah, while working on this project, previously I thought that nobody will support me because this is a neglected one. What I thought in the previous period. But while working and our dedication towards the development and other things, all the people support me. Next one, even the supporting this development partners such as World Health Organization and other also supporting. And the third one is that it's quite difficult to start a writing, but once we started it goes fluently. So these things I think myself as surprised that we succeed for the project, but still I'm working. Let's work for the successful completion. This startup and the completion till now is what I surprise is that the support from the other all sectors, even the government developmental partners, and even from the hospitals as well as other service provision providers.
That's great. It's great to have some positive surprises where you're worried, right? That you're doing
Yeah.
something very brave and you're not sure if your colleagues or the government will support you. And it sounds like you've been surprised by the positive support that you've received. So that's incredible.
Yeah, Natasha, still I'm sometimes worried about the successful implementation in the as a training of trainer and the implementation in the provincial level too, because it's quite difficult in the coordination and collaboration. Let's hope for the positive, but still there is a what to say. Sometimes there is a queries too.
Yes, still lots of work to do. Rashani, before we end off today, I was just curious, in all of your years of nursing, do you have, a patient story or a patient you remember that, benefited from palliative care, or where you saw this work kind of in real time, that a palliative care team or approach was able to help a patient? Do you have any stories you could share with us?
Mm, Actually, it's not like a story, but what I feel satisfied myself and my team is that we implemented the use of the morphine for the dressing to the bone. That's my satisfaction one. And the next one in our pediatric intensive care unit, while in the bronchoscopy, our physician, what to say, directly insert the bronchoscope without any sedative and some other things. While discussing with them, yeah, though the child cannot verbalize, child means below 1 year, cannot verbalize properly, the cry is their main words. So let's set it or let's have a symptomatic management to relieve the suffering. So that's also the what I thought is the achievements for the relieving suffering before any intrusive procedure or any other painful procedure. And the next one, I think you already saw in our oncology that for the interthecal Previously, they use only the analgesic, but now we use the sedative so that the children are not afraid with the intrathecal. Otherwise, in previous years, they start to cry 1 or 2 days before that. Now, my intrathecal is planned. But right now, most of the child is ready for the ITL intrathecal. But I didn't have such a long history of its conditions, but I'm satisfied with the palliative care in these areas.
That's amazing. Those are very big impacts that pain control and a palliative approach can have and will continue to have, hopefully, to impact children in a positive way and to ease pain and suffering and fears. So thank you so much. And it's incredible how many initiatives you've already been a part of. I think you
Yeah, but
directly have been so helpful.
yeah, we need to have a sensitization program as well as CME on these things. We need to have a regular stimulus to them. Otherwise, because as we know that we all are seeing the crying and suffering, and we ourselves also that is a normal. But we need to sensitize, stimulate, and support our health worker. Pain and symptom relieving is the first. That's we need to be repeatedly trained or need to sensitize our health worker. It's not only the doctor and nurses, even other levels too. But usually our doctor undermine. I'm not blaming, but usually they think that okay, this is the pain they need to bear. But still they're right that any treatment or any procedure should be the pain. What is it? Without pain, it's their children's right too.
Yes, that's such a good point that the myth that children don't feel pain or babies don't feel pain or pain is just part of the process is continues. I work in Canada and I hear the same idea, and we have to re-educate people, right? To say actually untreated pain has big consequences and can negatively impact children in so many ways. So we have to all work hard to re-educate people that these myths are not true and we need to be managing pain better. So I just wanted to say thank you so much, Roshani, for joining us today and hearing about your big, inspiring advocacy project that I know will change many lives of children and families in Nepal. So thank you so much for joining us today.
Yeah, thank you, Natasha, for providing such an opportunity to share my experiences. And it also give us the trust as well as the motivations to do something, again, something to do and improve our palliative care in our settings. Thank you, Natasha, a lot.
So, thank you all for listening to this episode of the Sunflower Palliative Care Podcast, and we look forward to sharing future episodes in this series with you. These podcasts grew from the seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is an initiative of Two Worlds Cancer Collaboration focusing on children's palliative care. We hope to build a world where no child suffers from serious, life-threatening illnesses. To learn more or to donate, please visit twoworldscancer.ca. Thanks and see you next time.